When I tell people that, they say, well, you look like a musician. Yeah, I dress like a rock star. Sometimes I'm called a prevention science rock star. Here's what a prevention scientist does. Make a short list of all the good things that you want to have happen to the people that you care about, and make a short list of all the bad things you don't want to have happen to the people you care about. I can wear my clinical hat and help you. That's not what I do. I work at whole population levels. Whole provinces, states, countries, and communities. When I sign a contract to do research partnerships, we make very certain that that contract includes, if there are adverse negative findings, they will be published, and I will know about them. My first dissertation study was on the prevention of pediatric injuries to children in the street, which was the third leading cause of death, and the first study ever done in the world in Sweden resulted in more kids getting killed. When I was working with Sesame Street, I really didn't want to wear that necklace, ever. So we have to be careful about our possibility of harm. What I want to do is inspire you that we can go well beyond science and publications, and we can actually affect the real world. I need that audio cable. Oh, I need the plug. Is it plugged in? Yes, it is. No. Where's the here? I think that works. This is the Doc Zone. This is the 60 Minutes of the Canadian Broadcasting Corporation. And this is angry kids, stressed out parents.
I, who would never thought I would shake a baby, there were times where I was holding her going, what is the matter?
For the first time in North American history, children now suffer more from mental health conditions than physical ones. Parents are coping with staggering levels of anger and aggression. Experts say kids who don't master self-control are at risk of growing up overwhelmed by mental illness, substance abuse, and criminality. Society pays the price in pain and dollars. But it doesn't have to be this way.
But it doesn't have to be this way. Now, this is Medicaid dollars. Mental, emotional, and behavioral disorders are the largest single expense in federal Medicaid in every single state and in every single private insurance carrier. And then the other things are attached to the same causal agents, like asthma, COPD, trauma. Those are all interrelated by the same biological mechanisms, and we treat them as if they were completely separate silos to our endangerment. Now, so the bloody tip of the modern demographic sphere is there were 38,000 suicidal deaths in the United States last year and 708,000 self-inflicted ER injuries. That does not include overdoses or single car crashes. Now, how many of you, I see some young people. How many people do I have under age 30 or 30? Okay. So for you, how many of you know a classmate from college or high school that committed suicide? Okay. Now, for the people over 50 or over, like me, raise your hand, please. Okay. For those of you who are 50 or over, I'm 66. Okay. How many of you had a high school or college classmate commit suicide? Look around the room. You can't fake those data. I did this in the halls of Congress. I want you to go back and use that technique to make very sure that people do not believe this is the result of overdiagnosis. That's the tip of the morbidity and mortality numbers in our country. I've already done that one. Now, good news from the bad news. So I'm going to show you more of the bad news. But in 1969, a paper was published in the Journal of Applied Behavior Analysis. Basically, everything on the list of all the lists of good programs all began as behavioral studies with single subject designs. If you are trying to develop a program or practice, if you cannot make a program or practice work with 3 people in an interrupted time series design, do not bother with a randomized trial. You will not make it up in numbers. The reason why the studies with the best results have all that history of single subject designs is they learned what the sources of variability were. Without knowing what the sources of variability, you can't do incremental and continuous improvement. So that first study happened. And then for 20 years, there was a whole bunch of other single subject designs doing the good behavior game in completely different ways, and they all worked. What does that mean? That means that's a robust strategy. You don't have to have the docent fidelity police with tasers there to get them to do it just so perfect that it works. I'm going to get on an airplane at 7 p.m. and I really do not want to know the one screw that's holding it up in the air. I want to know that there are many ways that it's being held up in the air. So anything that we're going to go to large scale has to have all of those design redundancies. You know, it can't be a hothouse orchid. Now there are reasons for hothouse orchids. If you're going to have a brain surgery, damn, that better be perfect. Okay? So then the first randomized trial happens in 1993 for the good behavior game. The first randomized trial for whole school behavioral supports happened was published and started in 1997. That was my study, the Peace Builder study, which showed was the first study to prevent medically coded violent injuries in school. Now, in 1999, a terrible event happened called Columbine. So I had to come here, and so did Shep Kellum have to come here to meet with the Secretary of Education, the Surgeon General, and the Attorney General, because everybody's noses were out of joints about kids killing kids. Okay, and it's still happening. All right? So we all talked, I talked, Kellum talked, and he talked about these results, but he didn't say what he did. I asked him, what did you do? And he said the good behavior game. I knew right away why that was a very powerful procedure. Almost all of the mental and emotional behavioral disorders that we've been talking about today have problems of impulsivity. So you have to teach people how to self-regulate and self-moderate their things, and the more negative consequences you put on them, then you trigger the ancient evolutionary mechanisms and genes for them to be more impulsive. They have more babies, and they get more violent, and they use more drugs. Well, how's that working for you, goes Dr. Phil. So we started to, we wanted to know, can you make this really happen in the world? So we tried it first with the original manual that was published, and oh, it was completely DOA. The reason why is time of history confounds. So in the original study it worked, but they gave the kids stickers and stamps and candy as reinforcers. Try that in a modern school. You'll be kicked out. So you always have to think about the context of the situation that you talked about, and it changes over time. So we fixed that, we commercialized it, and then now, in 38 states, 2 provinces of Canada, Estonia and Ireland, and now we're also about to launch in South America, and we reach 130,000 children in the United States alone. And you've gotten a little, I'll tell you more about those 130,000 kids. Now, everything I'm talking about is all these papers. You can go read them, and we've given you the list of where you can get those in the handout. Make sure you pick those up. So there's a whole thing about the logic. The logic model for doing population level change is completely different than the logic model for doing the research. It's completely different. You have social marketing, quality control, data system inputs, and the Pew Foundation guy was talking about. Then integration with existing things like the risk and protective factors. How you intersect with the meta theories like evolution and biological mechanisms if you're doing a behavioral thing. Then how do you do it as a public health model? Then how do you have a logic model that people can understand on the ground so you can fit in new data? That's in the American Psychologist with the critical role of nurturing environment. And then how do you design a new program when nothing is known? That was what I had to do for the Assistant Secretary's office. And then evidence-based kernels are fundamental units of behavioral influence. I had 90 minutes with Cabinet in Manitoba. Has anyone here had 90 minutes with the Cabinet of Government? Oh my God. So I wanted to convince you to do the things that you're talking about here today. Here's how it was done in 90 minutes. We took the headlines of the Winnipeg Free Press, and for the last month, showed the headline, showed an evidence-based solution. Showed the headline, evidence-based solution. Headline, solution, headline, solution, headline, solution. Every single solution was easy to do, robust, and low cost, and had large effects. The minister in charge of the cabinet meeting, Minister Rondeau, looks around the room, and ministers all have secret winks to each other. Minister Rondeau says, "Thank you, Dr. Embry. It seems that the consensus of the cabinet is that we should proceed." thank you, Minister Rondeau and members of Cabinet. And then Minister Rondeau says, and how soon could you make this happen? You get why that happened? That was because we were showing things that were current and on the political plate, and it runs in 2-year cycles. My answer was, thank you, Minister Rondeau and members of Cabinet. How soon can you write the check? That was November 10, and by January the 15th, Minister Rondeau called and said, we have the money, you can go forward. But the money happened by every member of Cabinet going to their closet and taking out their coin jar, and their coin jars are much larger than mine. Now we have a randomized control group trial. It's a population level of the PAXIS Good Behavior Game. That is a complete real-world thing. No technical assistance, just destination training and the materials, and within 1 semester we were able to reduce problem behaviors of moderately problem children in first grade by 17-fold reduction, multi-problem children by a 3-fold reduction, and most importantly, children who did not have problems did not get problems as the result of our intervention. That's an amazing finding. Now, this is a logic model. I'm not going to tell you about it, other than it's on your sheets of paper that you have, and that one handout displays every single bloody step, including the social marketing. One thing always to remember, never name your solution after the problem. Never. Never, ever do that. Now, create momentum. You have to link always to core values. You have to map to broad political and social benefits and threats. So that's what I did in that thing. So I can map through you. I can talk to every congressman that spoke today. I can be able to do what the Pew guy said. Here are the data for your congressional district and for any community in your district what the benefits of these strategies will be. And we can show you what they will be in timelines. And most importantly, deliver these clear early wins. You can say, oh yeah, we'll have a difference in 20 years. Great, wonderful. So what's the difference going to be 3 months from now? How will you know that something happened 6 months from now? And you damn well better have something that shows effects before the next election. That's the political reality. And if you have good science, you can do that. This is the polio epidemic. I have 3,000 deaths, 60,000 cases. And who got the vaccine during the polio epidemic? Who got the vaccine besides me? I got it in 1957. Okay? Some of you young ones don't know about this. Okay? So 3,000 deaths, 60,000 cases. The nation was in turmoil about this. And then along came the Salk vaccine, proving that the antibodies were changed. Not that it prevented polio. And then Thomas Francis did a study, a real-world study, about 1.8 million, and it worked. Polio was prevented, and then everybody got the shot. There was no risk assessment. Everybody got the shot. And the same is true today, because what is happening with all of these problems is that they are everywhere. 1 out of 2 children in America will have had a mental, emotional, or behavioral disorder by age 18. The rates are going up every 2 years in the best science funded by the National Institutes of Health. That cannot mean that it's a biochemical, well, it could mean it's a biochemical problem, but it sure as hell is not a genetic problem. I'm not going to dwell on that. The Wall Street Journal, which is the official publication of the Communist Party, that's a joke, you should laugh. Did an analysis of the psychotropic use of for children in the United States, published in December 28, 2010, and it showed that out of 75 million kids, 4.4 million children had at least one psychotropic medication in 2009. If nearly 60% of our children have to have a psychotropic medication to survive on a daily basis in the United States of America, if that were Toyotas, there would be no one buying a Toyota, and there would be lawsuits out the wazoo. Okay, we had the polio success. Then along came the IOM report, which essentially proved antibodies are possible. God to earth, it's possible to prevent every single mental, emotional, behavioral disorder, including the most serious ones which you have never heard. I have heard on testimonies and hearings in this Congress that it is not possible. And the day that statement was made by one of those people who actually funded the study that did this, which is the first randomized control group trial to prevent first episode psychosis in the world. Long-term 7-year follow-up were just presented recently. This has also been studied and funded by the National Institutes of Health. This is huge. Just in my state alone, this would have prevented 200 first episode psychoses. And we had a particular problem that happened in my hometown to some people that I know, love, and lost. Gabby Giffords is a personal friend of mine. I wept when I got the call. Ron Barber is a personal friend of more than 30 years. Gabe Zimmerman, young like you, I work with every day. I still cannot process that he's gone. And we had the tools and the knowledge. This particular strategy would have cost $12 to do. Okay? So a thing called the PAXIS Good Behavior Game, which is on the National Registry of Evidence-Based Programs and Practices, has many multiple randomized control group studies plus single studies. These are cost estimates from an independent source, the Washington State Institute for Public Policy. It would say, for example, 350,000 children out of 4,000 first graders from needing any special education. 250,000 kids would be more likely to graduate from high school. About 250,000 more boys likely to enter university. About 1/3 of a million more girls would graduate from high school. That's because they didn't have sex and get pregnant. About 40,000 fewer young people would be convicted and commit serious violent crimes. And the list goes on. And 267,000 fewer young men would attempt suicide. This is the first randomized control group study universally done in elementary schools to prevent suicide. No. It would say $53 billion for every single first grade cohort that goes through, which is why you have this example check. This is from the kids in, this one is from 2017, first graders to us. That's what this will pay back. That's the social marketing. Now, to do this, you got to have a dashboard. You have to show the change in real time. You have to have tools that people can use to show the people on the school board, the mass media, all of those things. If you Google PAXIS Good Behavior Game, you'll see videos, you'll see news stories all over the country taking this and putting the tools in the hands of real people. This is an example of the data. These are data that they collect. These are the reductions in disturbing, disruptive, unwanted behaviors. It's an 85% reduction. We have been in classrooms across this country that have more than 1,100 disturbing, disruptive, inattentive behaviors in an hour's time. There will be no learning. There will be crazy teachers, and that forecasts many problems to do. Now, we've been able to demonstrate within 10 weeks, for example, you can have a 45% reduction. In 3 months, thanks to SAMHSA, my colleagues were here from SAMHSA, they funded a real-world implementation of this in 20 places, and we were able to do that. So, we have now a business model. If you don't have a business model, none of this will work. That does not mean having business people on your board. This means how do you pay the rent, who will buy the dang thing, all of those things. So now we have a situation where insurances now are paying for the implementation. Nationwide Children's Hospital, Trillium, you can actually see this on the news report. Medicaid will be starting to pay for this in Ohio. School districts pay for this. Parents and grandparents pay for this to help their kids grant. Local nonprofits and for-profit providers become accredited to deliver the service so that they now get reimbursed because it's the local costs that are the highest. There's nothing, the materials are ridiculously inexpensive. Pre-service institutions are now teaching these things, like in Ohio, and states in Ohio, Washington, and Ohio are now using their block grants. Now, you can actually use periodic screening and diagnostic treatment for these kinds of prevention strategies, and now, thanks to the discussions that were members of Congress, we can do social impact bonds on this, and business leaders could be involved. The last thing we really need to do is to make sure that we treat our children as a common pool resource. This is Eleanor Ostrom, the first woman to win a Nobel Prize in economics. The old boys didn't like that very much, and besides, she wasn't even in a major league university. But she shows how to protect common pool resources. And ladies and gentlemen, our children right now in first grade are the most important common pool resource for the future of this country. We have science on that. The current ambassador from Canada, Gary Dewar, is the person who enacted the first piece of legislation like that in the Western Hemisphere called the Healthy Child Manitoba Act, and I would ask that he be invited to testify or speak to Congress about that. It's the most powerful thing. Now, this has also been shown, these simple strategies have been shown to change phenotypic gene expression. This is the first universal strategy to actually show the protective expression of brain-derived neurotropic genes, which are all implicated in the various things that we've been talking about. We have all of these informational resources. We have the television special from the Canadian Broadcasting Corporation. We have enough copies for every member of Congress, and we would like that to be delivered with the detail for their states and for their congressional districts. What we really have to do is have the gross well-being plus the gross domestic product. Gross well-being is a concept that David Cameron is promoting as Prime Minister of the UK. Now, out of that 130,000 young first graders right now, out of 4 million getting PAXIS, that 136,000 kids, that will save $1.8 billion. Small change